Professor Nicholas Spurrier, the Chief Public Health Officer, the Police Commissioner Grant Stevens, who is also the State Coordinator during this major emergency declaration. I said last week that COVID has challenged us, but it has not defeated us. It's fair to say that we are now facing our biggest test to date, but we can and we must rise to this new challenge. We have world-leading health experts and world-leading systems that have helped keep South Australia safe and strong. I want to assure all South Australians that we are working around the clock to stay ahead of this cluster. No effort will be spared to slow and stop the spread of the Parafield cluster. I've said from day one that we will not hesitate to act on the expert health advice, because keeping the people of South Australia safe and strong is our unequivocal priority. Time is now of the essence, and we must act swiftly and decisively. We cannot wait to see how bad this gets. We must act swiftly and decisively on the health advice to stay ahead of the game. Today, we have acted to supercharge capabilities at some of our COVID testing sites, including Victoria Park, Elizabeth, Parafield Airport and McGill, which are now open until 8 o'clock at night. I want to thank the people of South Australia for their patience in waiting to be tested today. This may seem hugely inconvenient, but testing is absolutely critical. Your response has given me great heart that we will rise to this challenge. We've also boosted our contact tracing team. This is an enormous task, and they will get every single resource that they require. Now, in a few moments' time, Professor Spurrier will go into the details, but I would like to advise that as of 2 o'clock, there remain 17 active cases, so no increase from this morning. 2 of those people are currently in hospital, not because of a deteriorating condition, but just because of their age, in an abundance of caution. And in fact, all 17 are stable with their condition. But before I pass over to Professor Spurrier, there are several matters that I would like to update the people of South Australia on. First of all, with regards to international flights, I would like to advise that all inbound international flights to Adelaide have now been suspended at our request for the remainder of this week. Our priority is ensuring that we have enough Medi-hotel capacity to meet any local quarantine requirements. This morning, I received a call from the Prime Minister, and I accepted his offer for increased support from the Australian Defence Force. We will throw absolutely everything at this to get on top of the cluster. With regards to aged care facilities, we have nation-leading outbreak strategies in our aged care facilities in South Australia. As soon as there is any positive case of a resident in an aged care facility, and I would like to stress that there is no confirmed case of a resident with the coronavirus infection in South Australia, but if there was, they would go straight to the Royal Adelaide Hospital. The next 24 hours will be critical, but we are not going to wait for the situation to deteriorate. We're going to listen to the expert health advice, and now I'm going to update you with some changes to the restrictions in South Australia. Can I say that these go into 2 separate categories? The first category is advice only. The second category is for changes to our directions, and they will come into force as of midnight tonight. First of all, with regards to the advice. Our advice to the people of South Australia is to work from home where possible. So we're going back to the situation that was in place around 2 months ago, to work from home where possible. We're encouraging vulnerable people to stay at home. We're encouraging those people to avoid having visitors visit them at the moment. We're also advising against any unnecessary travel at the moment, and we're also advising to wear a mask where it's not possible to physically distance, for example, on public transport. These areas are advice only. I'll now move to the changes to the directions, which will come into place as of midnight tonight. As of midnight tonight, we will have a direction which specifically prohibits activities at gyms, recreation centres, trampoline and play cafes. These will close. And can I just say that it is likely that we will have these directions in place for 2 weeks. Of course, if we can remove them earlier, we certainly will. But all of these that I'm talking about now, we envisage will be in place for the next 2 weeks. So gyms, recreation centres, trampoline play cafes to close. Community sports fixtures and training temporarily cancelled. And this applies to indoor and outdoor sports, contact and non-contact. But I would advise that outdoor fitness activities like boot camps can continue exactly as they were in the early days of the COVID restrictions in South Australia. Funerals will now be capped at 50 people, and it will be a requirement to observe 1 per 4 square metres. Churches capped at 100, again 1 per 4 square metres. Weddings, all guests must be registered with the CDCB, the Communicable Diseases Control Branch, via the online form, but at this stage, no changes. Private gatherings at licensed venues will now be capped at 50 with 1 per 4 square metres and no stand-up consumption. Hospitality, pubs, clubs and restaurants will be capped at 100 per venue with 1 per 4 square metres and no stand-up consumption even outdoors, and a maximum booking of 10 people in our hospitality sector, pubs, clubs and restaurants. Private residents are capped now at 10 persons per residence, and all activities with an approved COVID management plan scheduled for the next 2 weeks have been cancelled. Can I provide further information with regards to the directions that relate to personal care activities? This relates to areas like nails, tattoos and hairdressers. Masks will be mandatory for the service provider and encouraged for the client. Entertainment venues, so theatres and cinemas, 1 per 4 square metres. And finally, with regards to the aged care facilities, masks are mandatory where physical distancing cannot be maintained, and personal care workers are limited to one site only. Visitor restrictions of 2 visitors per day. Sites we know are already imposing greater restrictions. Can I make it very clear? These are not part of our direction, and they're certainly not something that we are encouraging. And finally, can I let you know that schools in South Australia will all remain open. We don't want to keep these new and changed restrictions in place for 1 day longer than what we need to, but the health expert advice at the moment is very clear. We are to act hard and early and keep these restrictions in place for a shorter period of time as possible. I absolutely guarantee that we will get through this. I've already seen an enormous response from the people of South Australia going out and getting tested before. So I will now hand over to Professor Nicholas Berry to provide us with further detail.
Thank you and good afternoon. So as the Premier has indicated, and I'm also very pleased to report, we have not had any new cases added to the Parafield Gardens cluster. So putting the cases together with yesterday, there are 18 new cases in total, with ages ranging from a 1-year-old through to a man in his 80s. Now, 13 of these cases are linked to the Parafield cluster, and of course we reported 4 of those yesterday, and 5 cases acquired infection overseas. So we still obviously have people in our Medi-hotels that have travelled internationally, and there were 5 additional cases. As the Premier's indicated, 2 of the cases are in the Royal Adelaide Hospital, but mainly because of the vulnerability associated with their age, and I've been informed that they're in a stable condition, which is great. Importantly, all other positive cases with this cluster are in our Medi-hotels, and this family, as people may be aware, it's a large family that make up the majority of this cluster. This family have been extremely helpful and have really supported our efforts working through this. In addition, there are 3 children associated with this family who, on our initial testing, and we've got different platforms to test COVID. One of them is a very quick turnaround, it's a gene expert, and those children have initially tested negative. However, because their parents have been positive and also because they have had symptoms, we're treating those children as though they are positive cases. Now, people would imagine that taking a sample from a small child can actually be a little bit difficult, so we're retesting those children to see whether they indeed turn positive, but we are treating them as positive cases. And because of this, we have had to close Mawson Lakes Primary School and preschool on that campus. Thomas More College also closed earlier this morning, and Holy Family Catholic School has also been impacted and is now closed. We have been following up with individual families where there has been closer contact with the child, and there are a large number of families now in quarantine because of those exposures. Just a reminder, the numbers may be difficult to add up, and I actually find it difficult as well when I'm looking at a whole range of different numbers, but we report case numbers for the previous 24 hours, so any cases which have come through today will be adding to tomorrow's numbers, but I can confirm that with all of the testing that we've been doing around the Parafield Gardens cluster, we haven't had any new cases to add to that cluster, and I am feeling very positive about that, I can tell you. So in total, there are now 34 active cases in South Australia. Total cases are 544 with 506 recovery. The other thing I would just like to remind people is that we have in South Australia payments, so some generous payments to assist for people who are asked to go into quarantine or isolation, and that's the SA COVID-19 cluster isolation payment. And $300 is available to provide support to South Australians who have been asked to self-isolate because of a public health direction and mandatory COVID-19 testing. And that's if they're not able to access any paid leave or other income support. People may remember that problems were faced in Victoria when people who couldn't access sick leave because they were employed in a casual way were not able to stay at home. They had to go to work because otherwise they couldn't support their families. So I'm very pleased just to be able to remind people that is available. There is some eligibility criteria around that payment, including the person must have been specifically directed by SA Health to receive a test and therefore to be in quarantine. So the other thing to say is that Commonwealth has a $1,500 payment available for certain people impacted by a cluster, and the full information is available on the Commonwealth website. Now, at the moment, as the Premier said, we have had a very busy, more than 24 hours now, both day and night, in CDCB, working methodically to do the contact tracing, but also, of course, informing people who are known to be impacted by the Parafield cluster. You may have been informed, if you happen to be one of these people, to go into quarantine by your workplace, because we are trying to speed this up as much as possible to try and block those chains of transmission. So you may not have heard directly yet from somebody from CDCB, but do what your workplace has said, and I will guarantee to you that very soon you will hear from CDCB to give you further instructions. So if you've been asked to go into quarantine, please do that. As the Premier said, we have extended our testing capability and also the hours of opening for Victoria Park, Elizabeth, Parafield Airport and McGill. So Parafield Airport has now opened up. So they open at 8 a.m. and go to 8 p.m. And thank you very, very much to people who have come forward and for testing. We particularly want people that have symptoms. You may be somebody that is asked specifically to be tested through CDCB, and it may be you haven't got any symptoms, so certainly we're expecting you to be tested, but otherwise for people in the public who are not associated with the cluster, testing with symptoms. And just a reminder, COVID symptoms can be very mild, just a scratchy sore throat, may be associated with a runny nose, a high temperature, not in all cases, so it could just be a sore throat, feeling a bit tired, maybe a headache, and occasionally people do have diarrhoea. But the other reminder is one of the more unusual symptoms is an acute loss of taste and smell, so just a reminder to people who may not have thought about it for a while. So we've had an extremely high volume of people through our clinics today. We had 173 tests conducted yesterday. I'm imagining we are going to have a very, very large number of tests done today, and a big thank you to SA Pathology, but also to private providers such as ACL and ClinPath, who are working very closely with us on containing this outbreak. So I'm very happy to take questions.
Professor, have you fallen short with the number of people lining up for tests today? We've seen people queuing down main roads waiting to get in. Were you anticipating that level of uplift?
Yes, we were anticipating this, and so first thing yesterday morning I spoke to the clinical director, Dr Tom Dodd of SA Pathology, very, very early in the morning actually, and we started prioritising who we needed to have testing for our cluster investigation. We needed to do quite a bit of domiciliary testing, which is having people go out to people's homes to do the testing, at the same time organise the additional pop-ups. But what I think you are seeing is absolutely the commitment of South Australians to get on top of this. We have seen a reduction in numbers in our testing over the last several weeks to months, but we do know that there are many people in our community who have got respiratory symptoms and haven't perhaps got tested during that time. So thank you very much for coming out.
Are you concerned about people panicking, Professor? I've noticed some of the social media posts is that you're asking people with either symptoms or links to the locations that you've warned about. Are you seeing an element of what you have previously said, the worry wards coming and getting tested?
Look, I think it's a bit too early to tell. What we do want is people with symptoms to get tested, because if we have a lot of the worried well come out and you know, get tested, it does mean that our turnaround time might blow out. But we have a particular way of having our forms filled out so that SA Pathology, ACL and ClinPath can prioritise those people with symptoms. We make sure that those get on the run the quickest.
Also, we've got some rules in place for people working across multiple aged care sites, but do we have any rules in place for people working across multiple Medi-hotel sites? There are 2 of them on that list. Can we assume that the one person worked at both of those?
So it depends on the actual site, because a number of the hotels work as a conglomerate, and so they do have staff going between sites. Now that's obviously if it's their own staff and it's very difficult to do that staffing, then that may be possible. I guess the other thing with Medi-hotels is the real way of preventing the transmission of the disease is by using PPE, and we know from the transfer via aerosol from droplets from person to person that the use of PPE can successfully stop the transmission. What I think we are seeing, possibly because we are in a community where we haven't had much disease, is there's possibly more of a role for fomite transmission, which is when people transmit it by touching their face and then touching objects and it getting passed on in that way.
What can you tell us about the origin of the cluster?
So to our initial review of this, it's clearly from a Medi-hotel. What we are waiting on is the results of our genomic testing. And so we already have done genomic testing. As soon as we get a case in South Australia, we do that testing. So we have a bank of all the genomic, which is showing the genome or the strain of the viruses of every person who's had COVID-19 in South Australia. So we have tested the 2 people who are security guards from a Medi-hotel and the 1 person that works in the Medi-hotel from back of house, and we are waiting to have that genomic analysis. Then we will be able to link exactly to which person they were able to get it from, which will be very, very helpful in terms of the beginning of this cluster. So we'll be able to look at the timing.
So just to be clear, it's a security guard that has...
So we have 3 people that work in a Medi-hotel. We've got 1 person that's employed by the hotel and works back of house, and then there are 2 security guards.
And is back of house cleaning staff?
So that's a range of different jobs in terms of back of house, but yeah, it's back of house.
And are they private security guards? Cleaning?
Yes, so back of house tasks include cleaning.
Are they hired by a private company, the security guards and the back of house staff?
So obviously the hotel staff are employed by the hotel. The security staff are part of a private company, but absolutely to stress, the way we have run our Medi-hotels is that the oversight is by SA Health and SAPOL, and so we have police presence at all times and nursing presence at all times in all of our Medi-hotels.
Professor, is this a second wave? Are we facing a second wave now as a result of this?
So what we are facing is indeed a second wave, but we haven't got the second wave yet. We are in very, very early days. So the first thing we need to do is, from my team's point of view, is the testing, contact tracing and getting people into quarantine very, very quickly. And that's what we have geared up to do, and we've described that today. The other way of getting ahead of this and to stop that second wave and to suppress it is to put some restrictions in place to reduce the number of close contacts between people. And finally, everybody has a responsibility. It's a mutual responsibility. Everybody in South Australia needs to continue to maintain excellent hygiene, hand hygiene, cover coughs and sneezes like this, and stay 1.5 metres from each other. And I know that's been difficult to do, and an element of complacency has, inevitably occurred here in South Australia, but everybody needs to heed those three messages.
I'm a little confused about the testing regime for workers in the Medi-hotel. You've said previously that you haven't been testing them regularly because it would discourage them getting tests when they show symptoms, but you have nonetheless now moved to a regime of testing weekly. Is that not a concession that is a more robust system of testing?
Look, there's nowhere else in Australia in their Medi-hotel system where mandatory testing is being done. It is something that I have strongly raised today with the Chief Medical Officer of Australia and indeed with AHPPC, and that would be my strong recommendation now with the situation in South Australia. The thing to point out with our issue here is that at least one of the people, if not two, but one definitely has not had any symptoms at all. So if we rely on people coming forward just when they have symptoms, we may miss something, which is why I'm recommending from yesterday that we will be doing mandatory testing. But what we will need to continue to do is not just the testing, but we have always had in place going through with staff every day. They need to make a declaration that they're indeed well, and of course using the PPE appropriately. Just also to comment on that particular point, New Zealand has had mandatory testing of their Medi-hotels every 14 days, and despite that, they have had quite a significant number of the staff testing positive. To be perfectly frank, this is a very, very contagious virus that is very easily transmitted from one person to the next. And we know that because even our very senior nurses in the Royal Adelaide, we had a case. She knew exactly how to use her PPE. We've had cases of our nurses in Victoria in aged care, again, highly trained, using full PPE and still managing to get infected.
Professor, have there been any links or any concerns raised to you about, firstly, the pageant on Saturday night, and has any of these family members who have tested positive, were they involved in any type of festival over the weekend?
So I can confirm to date, nobody has been at the pageant on the interviews to date, but we're still getting through all of these interviews. We have interviewed the entire family. So there was none of the positive cases attended the pageant. I attended the pageant. We had a very robust COVID management plan in place, and there were many things that possibly people attending the pageant weren't aware of that made it a safe activity. So for example, the makeup was being applied in a way which reduced the contact between the person applying it and the person receiving it. And a lot of the makeup was actually applied at home this year. The floats were spaced out, the dancers were spaced out. So having attended the event, I think actually it was a structured and very safe environment.
And sorry, just as a follow-up, was there a festival? Was there any link to a festival with this family over the weekend? And is that one of the lines of inquiry that you are looking at how they infected each other?
So indeed, there was a family gathering on Saturday night, but that's actually very recent. We've managed to get hold of all of the people attending that family gathering, and they are all in quarantine. So I don't have any lingering concerns about that.
Is that at a house?
Yes, it was.
Professor, how many close contacts of this parafield cluster are there exactly? How many have you identified?
It's a large number, and I don't have the exact number. I've got teams working solidly on contacting people and getting people into quarantine, so we haven't done a final count, and I can't provide that today.
Is it up to 100?
I would. It would be way over 100, and once we can have a little breather this evening, we'll see if we can do a tally.
Are the 3 people that worked at the hotel all family members? Yesterday we were told that 15 of the 17 were family members.
Yeah, so there's only one person who's worked at the hotel, at the Medi-hotel, that is associated with the family cluster, and then there's 2 other people that are not part of that family.
Professor, has our hotel quarantine system in South Australia fallen short here?
Look, I think there are different ways you could look at that. We had a national review recently, the Jane Halton review, and in fact South Australia got a gold star for that. We've been held up actually as an exemplar of a Medi-hotel system, to the extent that Tasmania, who are about to start their Medi-hotel system, came last week and we walked them through our processes. I would say that this is a highly transmissible virus that we should not underestimate. It has unfortunately got into our community. It looks like we're in the beginning or early part of what could be a second wave, but we have time to get on top of it.
Have you recognised the...
How are we any different to Melbourne? When they were in this position, why are we better placed than them?
Look, I think it's difficult to compare. I wasn't working in Melbourne. I don't have all the details. But all I can say is we've spent a lot of time planning. We've improved our contact tracing system. Again, we've had a national review of our contact tracing system. And again, we were given a big star for what we've done here. We've also got a fantastic community in South Australia. You have always got behind me when I've asked you to get tested. You've gone and got tested. The media, I also will give you a big shout out. You have always helped to get the messages out to the community. So whether or not we've got just that fabulous community spirit, but I feel very confident that we will get ahead of this.
Have you recognised the anger in
Do
the...
you think it's density and population? We don't have the high rise. Do you think that is going to work in our advantage a bit, that we don't have that kind of living?
Look, absolutely. I think when we saw some of the living arrangements in Victoria, in fact, our team was looking around the state to see if we had similar setups, and fortunately we don't. However, we still have very vulnerable communities and living where you've got a large number of people living together, particularly in our aged care. But what we have had time to do is learn from the experiences in Victoria, and in fact we have robust plans in place. One of the things that I took great comfort in yesterday was when we rang, actually before we had results back, but we rang nursing homes, we rang one of the correctional services, one of the fast food outlets, Hungry Jack's. All of those people, all of those businesses, those venues had a COVID outbreak plan, and they just got on and did it. They had a list of the rosters of staff, they had all the contact details, and they got on and did things without even the need for CDCB to go through and handhold. So we, you know, I really feel from my perspective a lot of comfort from that.
Is there enough? There's
Professor,
13
is that a-
nurses at the Lowell Mac who haven't been allowed to go back to work of the 90 or so tested. Is there any reason for this? Have they got symptoms or...?
No, so they haven't got any symptoms at all, but what we have is a risk matrix for our hospital staff. So when they have been working with a patient who then subsequently tests positive with COVID-19, we go through a risk assessment, and out of the staff that were in the emergency department when our first positive case was detected, on Saturday night, early hours of Sunday morning, we determined that 13 of those staff needed to be in quarantine.
Has there been a decision made today around the announcement on the Victorian border that was made on Friday, whether that's still going ahead?
Look, really my focus from Saturday night has been on getting in front of this cluster. I'm aware obviously that border measures have been put in place by other states. Look, you know, that date is a little far off, but the risk for us is within our own community. This is where we need to be focusing at the moment.
The changes to restrictions that the Premier read out earlier, are they in place for all of South Australia, including regional parts?
Yes, these will be in place for the whole of South Australia, but I do want to stress that we want to go hard, go early, but we will be reviewing it, and we are saying 2 weeks, but it may be possible to lift that earlier.
Professor, can I just ask you with the hotel?
How many cases do you think that you can handle before you lose control?
So we have been able to get a reserve force so that we would be able to manage 100 cases a day. However, when you imagine getting a case and then doing the interview, it depends how many close contacts there are. So if one person has 100 close contacts because they've been out at a venue, then of course all of those close contacts need to be spoken to be requested to go into quarantine. So this is why the number of contacts per person really impacts on the work of the contact tracing team. What I have done, because I want to get ahead of this and I want to make sure that we do, is reached out to Western Australia, and we've got some assistance from WA contact tracing team. They haven't got much to do at the moment, and we also use the same IT system. And I've also alerted the Commonwealth. The Commonwealth also have a group of contact tracers. So I'm pleased to be able to, reassure South Australians that not only do we have a good system in our own state, but we are able to also get assistance when we need it.
Professor, can I just ask you, sorry, Mike, for the Premier, what type of reviews are now being undertaken into our hotel quarantine program?
We do a regular audit, so we do a very regular audit of our hotel quarantine system. We treat it like a hospital, and so we have a risk assurance process that we undertake. People might know, because we had such a high number of cases recently, I did a bit of a walkthrough myself because I just wanted to eyeball it end to end and see whether there were any things that needed improvement. We have, in the last 2 weeks, increased training of PPE to the security staff in particular. Of course, our nurses are very good at this anyway, but we wanted to do some refresher face-to-face training with the security staff. As I said, I have brought in the mandatory testing for all staff, regardless of whether they're employed by the hotel, by SAPOL or by health.
That training, was that because the security guards were becoming complacent?
No, it's just that using PPE is not straightforward. You think, oh yeah, whack on some face mask and some gloves and a gown. Putting it on isn't too difficult, but removing it safely is difficult. And so even when I went down to the airport and put my PPE on, I had the infection control nurse watch what I was doing to make sure that I had it on in the right way, and then that I removed it in the right way.
Have you identified any lapses in infection control so far?
Look, we're reviewing and monitoring on a daily and hourly basis, and that's the reason for having nurses and infection control practitioners in the Medi-hotels. So it's difficult to really respond to that.
Can I just confirm, you said earlier, just with Professor, can I just confirm, were there any new cases today? You said earlier there were 5 new cases? Was that...
Yes, so we've had 5 cases acquired with infection overseas. So you've just got to take into account that we reported some yesterday, and I updated earlier in the media on radio this morning. But in terms of getting anything new since the 17, there's not been anything new.
So you actually said 18 earlier, is it 17 or 18 involved?
So today we've got 18 new cases in total, but there's 17 in the cluster, and then there's 5 that had their infection acquired overseas.
Sorry,
So what's the total of the cluster?
17 plus there's 3 children who have tested negative, but we're treating as cases.
Did you say earlier, was it 13 and 5, the 5 overseas? Sorry.
Yeah, so, yeah, we will give you the numbers, but I can give you absolutely definitively, there's 17 cases in this cluster.
How many of the family, of that 17?
Yeah, there's 15, and then there's there's two that are in the two that are outside of the family, and 15 that are the family.
And in that 15 include 3 children who might not have it?
No, that's an addition.
Okay.
So how
Yeah.
do those infections
Yeah.
overseas fit in with the cluster?
So they don't, but I'm reporting for you today the total number of cases in South Australia in the last 24 hours.
Professor, I'm sorry to just be even more confusing to you. The 3 children that have tested negative but you are counting as infectious, are they part of the family or are they outside of the
No, they're
family?
part of the family, yeah.
Just to clarify, in terms of the locations that SA Health has released for people to assess, does that imply that you've had people who've returned a positive test who have been travelling on public transport on a daily basis for some days?
Yes, so what it shows is all of the places where somebody who has been infectious has been, and that's to alert South Australians to have a look at that list. We are updating it as we do more interviews, we'll be updating it. So keep an eye on it, and we'll try and really helpful if the media can do some shout outs on those places as well, particularly on radio, so people know about it, to monitor for symptoms and get tested if you get symptoms.
Premier, could I ask you a couple of questions,
Could I
Premier?
actually- Sorry, thank you.
Premier, are you aware of the anger in the community around this hotel quarantine issue, and what is your government doing to get to the bottom of it?
I think the people of South Australia just want a speedy resolution to this cluster, and what I've seen is South Australians going out and getting tested in absolutely massive numbers today. That's what we asked them to do first thing this morning when we understood the full magnitude of this cluster, and that's precisely what they've done.
What would you say to that anger, though? What would you say to the anger? There is anger in the community, and do you recognise it?
My focus is on getting on top of this cluster as quickly as possible. There's plenty of time to review this afterwards. As Professor Spurrier has said, this is a very nasty disease. It's highly contagious. People with decades of training still become infected from this disease. So we're not apportioning blame at the moment. What we're doing is acting very, very swiftly to get on top of this cluster as quickly as we possibly can. The restrictions, the changes to the advice that we've outlined today is hard. It's early. That's the advice that we've received from the experts. That's what we're putting into place. We hope to have these restrictions, these new restrictions in place for a shorter time as possible.
Were you complacent on hotel quarantine?
We had last Sunday when I asked you, we had 19 active cases in our hotel quarantine, which was more than a quarter nationally. Can we just bite off more than we can chew?
Well, everybody around the country needs to play their part in returning these Australians to our shores. These are Australian citizens who have been stranded overseas. They need to come in and be quarantined for a 14-day period, and South Australia is playing its role.
Professor Spurrier mentioned that it was disproportionately high and that had made it difficult for some.
Well, take a look at the figures that were released on Friday. There were 77 active cases in the country. 17 of them were here from South Australia. So it is a high level that we have in South Australia. Earlier in the disease, of course, South Australia had a very low infection rate. So it moves around a little bit, but I believe that we do need to play our role in this national repatriation.
Professor Spurrier mentioned a pandemic leave.
Yes.
Does your government have to pay out any of that this time around yet?
I don't have the details, but of course most of that would just be coming through now. But it is really important that we don't have people that say, well, I'm not going to be able to take that leave if I'm potentially infectious. So they don't go and get tested. This is not what we need in South Australia. We need everybody that's asked to by the CDC to go and get tested immediately, to isolate before that result comes back. And if they are asked to go into 14 days of isolation, that they do this as quickly as possible. Can I say that we are very, very happy with the response that we have had so far.
I mean, how are you feeling today, given on Friday you were flagging relaxing restrictions this week, and instead you're reimposing them?
Yeah, well, look, it's a very dangerous situation that confronts us at the moment, and time is absolutely of the essence. So we're moving as quickly as we can, responding to that expert health advice. I am confident that we'll get on top of this. We have excellent public health administration in South Australia. We've got excellent police here in South Australia, but most importantly, we have the cooperation of the people of our state. They know the consequences of not getting on top of this quickly, and we have seen excellent cooperation to date, and for that I'm very, very grateful.
Brownie, what's the plan with bringing international students into South Australia?
Well, as I outlined at the outset of the conference, we're suspending all international arrivals into South Australia. That was done at our request, and that will be in place for the remainder of this week.
Are you looking ahead to big events like the cricket? Surely this casts a shadow over there.
Well, the cricket is still some time down the track, and we'll deal with this as quickly as we possibly can. If we act decisively and quickly, we get in front of this, I'm hopeful that we can get this resolved in the coming weeks.
Are we able to stand up any interpreters for any of the minority groups affected?
One of the things that we are really pleased about is the excellent cooperation that we've had from the multicultural communities in South Australia, and where they've been asked to translate and speak to their communities. That's exactly and precisely what they've done, and I think this is one of the reasons why we've been able to stop the spread in South Australia to date.
Premier, have other jurisdictions potentially jumped the gun on shutting down our borders? And with the recommendation of travel, is that intrastate travel, or is that travel as well as in South Australia?
Well, with regards to your first part of the question, look, these decisions regarding border arrangements for other jurisdictions are their decisions. We don't offer advice. What we do is provide the data. Now, we've been the recipient of a lot of that data coming from other health administrations around the country, and for that we've been very, very grateful, and it's informed us making our decisions. We're going to be now, instead of, if you like, receiving that data, we'll be transmitting it, and we've got very good working relationships with the health administration around the country. With regards to the second part of your question, can I just say what we know is that if we can reduce mobility, we can slow the spread of the disease, and so we're not giving a direction that you can't go on any travel. What we are saying though is think about, and any unnecessary travel would be something that we would advise against, but we're certainly not making it a law, we're not issuing a direction, but reducing mobility massively helps to slow the spread of the disease.
In general, so intrastate and locally in South Australia?
That's right. All travel. We just say, look, if it is something that that is spontaneous and can be avoided, well then we're saying don't proceed with it. If it's something that you've booked or something that's important to your family, just please observe the general focus of our advice, which is maintaining social distance, very good hygiene. If any symptoms have developed, get off and get yourself tested straight away. If we follow these simple instructions, then we will get on top of this.
The limit that you have on home gatherings,
10.
the 10-person limit, does that include children?
Yes, so this is at the moment, this is it's a very heavy restriction, but again we know that this has been something which has been enormously effective in slowing the spread in other jurisdictions, so a maximum of 10 people. If there are already more than 10 people in that residence, of course, this won't affect them, but if you've got 6 people living at home, you can have up to 4 people that would come to visit. It's not an additional 10.
Would you advise against people booking Christmas holidays now at this point in time? Would you say?
No, look, I wouldn't, because I remain very confident in the people of South Australia, working with SAPOL, working with SA Health to get on top of
Is
this.
your intention still to open the Victorian border on December 1?
There's no change to that at this stage. I think Victoria has done extraordinarily well with managing the coronavirus second wave in their state. They continue to have good results today, and I can't see why that would change.
Commissioner, could we have a word, please? Are you concerned about, given what's happened with hotel quarantine and Professor Spurrier saying that you know, the source of the Parafield cluster is from Medi-hotels, are you concerned, or have you had any concerns about the security of our Medi-hotel program?
No, let me say that South Australia Police has been providing the supervision for private security guards who have been working in our hotels. We are maintaining a high level of vigilance to ensure that those people working for us are abiding by the requirements for PPE and also fulfilling their duties as they are prescribed. We are talking about a large number of people who are undertaking difficult duties for long periods of time. We are reminding them of their obligations on a regular basis. We do see some minor infringements or transgressions in relation to certain activities, but none of those would present any specific risk, and we are on top of that on a daily basis. I couldn't be more confident that we are providing as secure arrangement as possible in relation to how we manage our Medi-hotels. But as has been pointed out, this is highly infectious, easily caught, and even the very best medical professionals can actually catch this whilst they're doing their very best to avoid it as well. So given the circumstances and our obligation to repatriate Australians, this is a reality that we're now dealing with.
And compliance checking over the
How
next
has this affected
fortnight?
your workforce? How many officers have been tested and has this made a
Yeah,
impact?
we have 96 officers who are currently quarantining, awaiting test results. Obviously that has an impact on us as well. We are maintaining our border arrangements. We're obligated to do that, and we're undertaking compliance checking for those people who are quarantining at home. So this is just an additional factor that we have to build into our current operations. It's not something that we didn't envisage. In fact, in the early stages of COVID-19, our primary focus was making sure that we're able to maintain service delivery in the event that our workforce was being quarantined or suffering from the virus.
Does this mean that schoolies is off? There's hundreds of students about to head to parties.
The schoolies is in all likelihood going to continue. The recommendations in relation to travel, as the Premier highlighted, don't exclude schoolies. What we are reminding people is that there are specific limitations in terms of short-term stay accommodation, and they must be complied with. So it is essentially the number of beds in a place plus 6 visitors is what was permitted under the arrangements for schoolies, and at this point there are no changes to that. It may occur over the course of the week. If we see things changing, it will have to give short-term notification. But at this time, we'd ask people to consider the need to travel. If they have made bookings and they wish to travel, then they may do so. But there'll be close monitoring of compliance.
What about the schoolies functions at licensed venues? From memory, there was a limit of 50 people per venue. Is that still the upper limit?
The same limits that apply for all private functions in licensed premises will apply to schoolies functions as well.
Compliance checking over the next fortnight. What's SAPOL's view? Are you going to be taking the educational approach, or is it time now for a little bit more heavy-handed approach to try and stamp this out?
Look, we've been quite upfront that we will take an enforcement approach where we see people that are blatantly disregarding their obligations for quarantine or refusing to comply with the advice we provide. As I've said before, invariably when we've visited people where we have seen non-compliance, it's not because of a lack of will to do the right thing, and education and support is the way to go. We've had great success because we have worked with the community. Using a big stick won't deliver the results we're looking for. We want people to do the right thing. We want them to know they're supported by South Australia Police and Health as well, and we'll be continuing in that vein. But if people do the wrong thing, and they do so knowingly, then they should expect that there'll be a sanction.
We saw in Melbourne people were a little bit less willing to fall into line the second time round. Are you anticipating that people might not be that thrilled with some of these restrictions coming back in?
Look, I'm certain there's a high level of disappointment within the community that we've had to go back to these sorts of restrictions. The assurance is, providing that things remain the same or we're able to keep on top of this, that it will be for a 2-week period. But that obviously there's a caveat there that if we see a continuing spread of this particular cluster, then we'll have to take other action. We would encourage venues and patrons to do the right thing in this short-term period so we can actually get on top of this. That's where we're going to make a difference here. If we let things run as we become used to, then the chances of SA Health being able to get on top of this cluster become much more difficult, and will probably pay a greater price in the long run.
Can you
Last couple, guys.
Can you give assurance to the community that the hotel quarantine system in South Australia is robust enough?
I can absolutely assure the South Australian community that the hotel quarantine system in South Australia is as good as anywhere in Australia. As has already been indicated, we have been visited by other jurisdictions who have examined how we've done it. We've also been independently reviewed, and we've passed with flying colours. I'll say this again, there is only so much we can do to limit the spread of this virus. It is highly infectious, and despite all of the measures we put in place, the risk still remains.
So with this,
Last
is
question, guys.
there an element of complacency that might have snuck in, firstly to the hotel quarantine arrangement, but also to the community in general? And are we paying the price for that complacency?
Look, I'm quite certain there is no complacency within the quarantine hotel environment. My officers are conducting regular inspections. We're using CCTV to monitor compliance with all staff inside the facility. And in terms of the broader community, we've observed levels of complacency because we have been doing so well in South Australia. We have encouraged people to remember the social distancing and the hygiene requirements, and also to comply with COVID marshal requests. this is a wake-up call for us that COVID-19 has not gone away. As much as we might feel frustrated by these ongoing restrictions, they are there for a reason, and people need to start thinking about how they can do a little bit more to keep on top of things. Thank you.
Now, 17 plus 5 equals... So stay. 17 plus 5 equals...
Parasites.
Not bad. Not bad. Not bad. Good sign. Come on. That's impressive.